So, my name's Ruth Hogg, and I'm a senior lecturer at the Centre for Public Health in Queen's University Belfast. My PhD, when I started way back in 2001, looked at the relationship between AMD and nutrition. So, I'm always delighted when I'm given the opportunity to talk about this interesting topic. I'm also often struck how often the topic comes up in the question times when I visit the local macular groups in Northern Ireland, even if I'm speaking on something unrelated. And for this presentation, while I've prepared slides, they just contain photographs of what I'll be discussing. So things like the types of food or maybe the logos of the studies that I'll be discussing. There's no additional information in the slides. Therefore, those of you that have severe sight impairment won't be in any way disadvantaged by the slides. So the association between diet and age-related macular degeneration has been the subject of scientific investigation for several decades now. Researchers have explored how dietary factors can influence both the development and the progression of AMD, leading to a deeper understanding of the role that nutrition plays in maintaining good eye health. So to begin with today, I want us to look back to look backwards to where the evidence first emerged to suggest about what you ate was important in the development of AMD. So in the 1980s and 1990s, studies began to highlight the potential link between diet and AMD. So researchers observed in certain populations, such as those with high fish consumption and in antioxidant-rich diets, that they had lower rates of AMD. There were three population studies in particular. So the Rotterdam study in the Netherlands, the Beaver Dam study in the United States, and the Blue Mountain study in Australia all contributed to this knowledge by studying groups of people as they got older. They obtained lots of information about their medical history, their lifestyle, and their diet. And they also undertook regular retinal examinations with a retinal imaging approximately every 5 years. And during the follow-up time, some participants developed AMD while others didn't. And they discovered that those with high antioxidant rich diets that contained lots of vitamin C, E, and zinc, tended to have lower rates of AMD. And also that those that ate lots of dark leafy vegetables also seemed to be less likely to develop AMD. They also began to notice some interesting trends depending on the types of fats that people ate. They observed that in certain populations, those with high fish consumption, so rich in omega-3 fatty acids, had lower rates of AMD, while those consuming predominantly saturated fats tended to have higher levels of AMD. So taking all of this information together, it was used to plan a large trial to investigate if supplementation, rather than just dietary intake modification, could change the course of AMD. So the age-related eye disease study, or AREDS, was initiated back in the 1990s, and it reported its findings in 2001. And it played a significant role in shaping our understanding of diet's impact on AMD. So this study investigated the effects of high-dose antioxidant and zinc supplementation on AMD progression. I'm sure many of you are familiar with the term drusen, the small dots of waste material that we can see in the retina that indicate the early stages of AMD. So the ERID study recruited participants with medium or large drusen in both eyes, and also some patients with wet AMD in one eye and drusen in the other eye. And the ERID study found that these combination of high dose vitamin C, E, beta carotene, zinc, and copper reduced the risk of a progression to advanced AMD. So while ERID's one study was ongoing, more and more evidence was accumulating about the benefits of green leafy veg and their important constituents, lutein and zeaxanthin, which were thought to be providing the protective effect. Lutein and zeaxanthin can filter the harmful blue light at the back of the eye, and they also can act as potent antioxidants. There was also increasing concerns about the high dose beta carotene, as several supplement studies showed a link to the development of lung cancer in those who smoked. Therefore, despite the positive findings from ERIDS 1, a second trial was started in which the beta carotene was replaced with lutein and zeaxanthin, and the results were released over a decade later in 2013. So overall, the new formula, while it confirmed the same type of findings as the first study, it didn't reduce the progression any more than the original formulation. It also studied specifically the impact of omega-3 fatty acids, but did not find a significant overall effect on reducing advanced AMD. However, in some subgroups, particularly in people who had very low dietary intakes of fish, there did appear to be a benefit. So while these studies did suggest the benefit to those who have medium or large drusen or wet in one eye and dry in the other of taking supplements, the size of the effect is modest. And in the UK, NICE, the body that makes the decisions on new treatments and drugs, has decided that they do not meet the standards to enable them to be included within the NHS formulary or provided via a GP. So this has been looked at on various occasions since the first ERID study, and it was most recently assessed by NICE when they looked at guidelines for treatment of AMD in 2018. An expert panel reevaluated all the evidence, and they decided that it was insufficient to recommend for widespread use, but that a UK-based ERID study should be considered as a high research priority. So this leaves the decision as to whether to take supplements or not with the patient and their family. And if this is the situation that you're in, it's worth remembering that the Macular Society has some excellent information and advice available on their website to help you to consider the options when making such a decision. If you decide to take a supplement, it's important to discuss it with your GP, because it's known that some vitamins can interfere with other medications that you may be on. So in more recent years, research has focused less on individual foods or nutrients and more on the patterns of dietary intake. So this recognizes that people don't eat foods in isolation, that they often tend to eat a pattern of food. So those that eat lots of fruit and veg may also be more likely to eat whole grains, whereas those that eat lots of crisps and sweets and treats often eat more convenience foods and sometimes have a lower fruit and vegetable intake. So this has allowed researchers to compare how people can adhere to a particular dietary pattern. And one pattern that's received a lot of interest recently is the Mediterranean diet. So, the Mediterranean diet is a pattern that's inspired by the traditional eating habits of countries that border the Mediterranean Sea. So, places such as Greece, Italy, Spain, and southern France, where people historically tended to rely on local and seasonal foods. So it gained international attention in the 1960s because researchers observed low rates of heart disease and other chronic illnesses among populations who were following this dietary pattern. So there's now robust evidence to show that those who adhere more closely to a Mediterranean style diet, have a lower risk of developing advanced AMD and also a lower risk of progression of AMD stage. So, this evidence includes longitudinal studies where participants are followed up over time, which is considered the most robust form of such evidence. And it also includes studies from both America and Europe. A recent European study looking at over 4,500 participants and followed them for 4 years showed that higher adherence to a Mediterranean style diet was associated with a 41% reduced risk of advanced AMD. So this really supports the role of a diet rich in these healthy, nutrient-rich foods. So looking now at what a Mediterranean diet contains. So it's characterized basically by a balance of whole foods. So it emphasizes lots of fruits and vegetables and whole grain foods as opposed to a white bread or white rice, and also encourages the consumption of lean proteins, particularly fish and poultry, as opposed to red meats, and also encourages the intake of healthy fats. So in the Mediterranean countries, this is obviously primarily olive oil, but in here it may be a rapeseed oil is also similarly healthy and widely available. It also encourages the intake of legumes such as chickpeas and lentils, as well as nuts and seeds. It encourages a moderate consumption of dairy products, particularly yogurt and cheese, and the occasional consumption of red wine in moderation. It should also be accompanied by daily physical activity and a regular water intake. You can see, so it also is helpful thinking about the proportion of foods, because the Mediterranean diet, the vast majority of the diet is the fruit and veg and whole grains, and only a small proportion is the dairy products or proteins. So I understand that making changes to diet like this can be challenging, and I know that our diet in the UK tends to be quite different to what I've presented. However, it's probably achieved best by making small stepwise changes, adding some of the components here or there, or substituting items. So some of the patients that I've met at Macular groups, in an attempt to do the right thing with some of this dietary advice, have begun to eat large quantities of a specific food, sometimes things like spinach and kale. So nutritional research would suggest that it's better to eat a variety of healthy foods, as different foods contain different beneficial nutrients and often in quantities that are well suited for absorption and use in our body. It's worth remembering that some of the ways that we uptake these nutrients are competitive. So if you take a lot of one particular food containing a specific nutrient, it may mean that your body isn't able to take up as much of another nutrient. And also, forcing yourself to eat daily large quantities of a food that you may not really like is also no fun. So recently, nutritionists from Harvard have been promoting this concept of encouraging people to eat a rainbow. So it basically refers to consuming a whole diverse array of colourful fruits and vegetables, with each colour group offering a unique set of nutrients and health benefits. It's interesting that it's often the coloured pigments in the fruit are often actually the really beneficial nutrient that has the health benefits. So including a variety of colours in your diet can contribute to overall well-being and support different aspects of health. And it's also a much more fun way to eat, because you should be able to find ways to eat both healthy and also to enjoy it as well. So now, back to sort of the practical implementation of this advice. So I live in rural Northern Ireland, so I'm approximately 20 miles from the nearest large supermarket. So I do appreciate the difficulties and challenges in maintaining a high fruit and veg diet containing a wide range of colours and variety. I tend to get home deliveries approximately every 2 weeks, and if you had a look in my freezer, you'd find that it was full of frozen fruit and veg and fish. So the variety of veg mixes available now is really excellent, and they're really convenient for adding to pasta sauces, soups, or stir fries. The frozen fruit I use at breakfast with some yogurt, and they all tend to be very good value. And you don't also don't have to kind of stress out about whether they're spoiling at the bottom of your fridge. I also tend to keep a bag of frozen fish mix in the freezer, and there's some really simple recipes on the BBC Good Food website for using fish mixes in things other than just fish pie. And also tinned fish is also a really good, convenient option, and there's a whole range of flavors now uh, to make it more appealing. So the final the final thing that I want to address is to recognize the genetic component of AMD. So this is now well understood, including the specific genetic mutations that mean that someone is more likely to develop the disease in later life. So while your siblings and your children are not by any means guaranteed to get AMD, we do know they are at higher risk than the rest of the population. And there's now good evidence in European populations to show that a good diet and a healthy lifestyle can delay or prevent progression to advanced disease, even in those with high genetic risk. Because of this, researchers are increasingly now looking to the next generation, so to the adult children of AMD patients, as to whether changes in behaviour in early life can be made to be able to reduce the risk of sight loss when older. So there's lots of good evidence to support that this is a good idea, but it's obviously difficult to design studies to prove it definitively, given how long patients would have to be followed up. But it is worth having these conversations with your family, as the types of lifestyle change, such as increasing physical activity, improving diet quality, and stopping smoking, will have beneficial impacts not just on their eye health, but on heart, cardiovascular, and brain health as well. It's also important that they get their eyes regularly checked by their optometrist, and it's worthwhile them letting their optometrist know their family history so that they can be specifically looking for signs of drusen development, etc. So in conclusion, there's strong evidence to support the preventative impact of a healthy diet on the development and progression of advanced AMD. In discussion with your ophthalmologist or optometrist or GP, you can decide whether supplements are the right choice for you. But it's worthwhile making small stepwise changes in your diet to adopt more of the practices of the Mediterranean diet, including a wide variety of colours. And finally, I'd encourage you to discuss the increased risk of AMD with family members and encourage them too to adopt a healthy diet and lifestyle and to regularly get their eyes checked. Thank you.